Top 10 Unsolved Mysteries of the COVID-19 Pandemic. Number 10. Why are young, fit people dying? 2. One of the most concerning parts of the pandemic is the disproportionately high rate of fatalities among the elderly. This allows the virus to spread virtually undetected among younger, less vulnerable parts of the population. Number 9. Can we infect animals? There's still fierce debate around exactly which animal it was, with pangolins, bats and even poultry as potential suspects, though we're guessing researchers will get to the animals once they're done with the humans. Number 8. We still don't understand its biology. We simply don't know what it is about the SARS family of coronaviruses that makes them so deadly to humans, or even, as we'll come to in a bit, how it learned to affect humans at all. Number 7. Its evolution in humans is still poorly understood. The biology of the virus may help us better understand its effects, though there's still the question of exactly how the SARS-CoV-2 strain learned to infect humans at all. Number 6. People are testing negative, and then positive, while we grapple with tens of thousands of cases showing up around the world every day. Doctors are faced with a new unexplained problem. Many patients that were previously found to be negative are now testing positive, calling into question the very methods and tools we're using to detect it. Number 5. The carriers with no symptoms at all. We've dealt with far deadlier diseases than this one in the past. It's nowhere close to the Black Death or the Spanish flu in its death count or rate of infection. It is, however, different in one way. Infected people could go about their lives with mild or even no symptoms at all, helping it reach even more people than any of those diseases ever could. Number 4. Why are children so good at fighting it? It's no breaking news that the novel coronavirus strain affects everyone differently. The number of fatalities are way higher for the relatively older people, which is popularly explained by their weakened immunity. That sounds like an intuitive explanation, though not if you consider that the virus is virtually ineffective on children. Number 3. How do patients recover? Usually for other diseases, patients recover by developing antibodies. That's not the case for a surprisingly high number of recovered COVID-19 patients, and researchers are struggling to understand why. In one study done in China, most of the recovered had developed antibodies specifically meant for the SARS-CoV-2 strain, which is how we'd expect it would work. 30% of the patients, however, had no signs of those or any other related antibodies, and it's unclear how their bodies recovered at all. Number 2. The invisible line of transmission. Worryingly, though, we're also seeing quite a few baffling cases from around the world without any discernible route of infection. For one, a toddler in Gujarat, India got infected and died despite there being no known cases in that entire district. And one man in California became the first American to contract the virus without coming into contact with any potential host. Number 1. How does it spread? The biggest mystery of the COVID-19 pandemic is that we simply have no idea how it spreads, and anyone who says they do is just hazarding a guess. While it was earlier believed that it could only spread via physical touch, new